Hi everyone, very good afternoon. Before starting with the interview, I would like to introduce myself first. My name is Durga Chapagai Sivedi, an external student for CDU, and thank you so much for providing an opportunity to sit for interview, and I'm ready for now. Thank you so much.
Here is your first question. Can you tell me about a time where you recognized adverse changes in your patient's condition and how you responded?
Thank you so much for the first question. I would like to give an example that occurred during my second year placement in Camera Hospital. I did really quick action upon my patient deteriorating conditions and effective communicated with the healthcare team about the situation. While caring a patient who undergo total hip replacement surgery, I noted her blood pressure was dropping to 80/50, and the patient didn't voided post-op aid and didn't have anything to eat and drink. The dressing was dry and intact, and I was monitoring him. And at the same time, the patient condition after 15 minutes observation, I took another observation, took her vital signs, and I came to know her blood pressure was still sitting on low, and the patient looked pale, and her oxygen saturation dropped to 80%, and she looks like she's having a shortness of breath as well. Without any delay, I pressed the emergency buzzer. At the same time, my preceptor RN and other senior nurses came to assist that patient. As per preceptor RN instruction, I delivered the oxygen via Hassan mask to my patient. And after putting the mask and delivered the oxygen, patient after a few minutes or after 5 minutes, she started to regain the consciousness. And soon after intervention, after that I still monitored her vital signs to get fully conscious. I then documented situation in patient notes during end of the shift.
Number 2 question. What is work health and safety? And can you give me an example of your application of work health safety in clinical practice? Thank you.
Thank you so much again for another question, madam. Work health safety includes safe working environments, safe system of work, plant substances in safe conditions, facilities for the welfare of our workers is known as work health and safety. At the same time, I'd like to add one of my experience when I did my placement. It is all about my second year placement in the hospital where I was allocated for, and I was carrying one of the post-op patient who came back to the ward after hip replacement, and she was in anesthesia, or she was given anesthesia. After 5 minutes of arrival, she showed the signs of discomfortness and complaint, being nauseous. Soon after, she did vomit as well. And to control her nausea and to provide comfort to her, me and my preceptor RM, as per PRN charted by the doctor, we decided to give her medication via intravenous. While preparing the medication, I used PPE, personal protective equipment, for the safety of myself to prevent from absorption of medication, and also same time I use the 6 rounds of medication ways of administration strategy to reduce the medication error for the safety of my patient and myself as well. Thank you so much.
Third question. You have a Muslim woman going to theater for DNC post mid-trimester delivery for retained products of conception. As you prepare her for theater, she refused to take off her hijab. How would you manage this situation?
Thank you so much again for another question. From the scenario, we can understand patient belongs to the different country. That means we need to be aware of cultural competency, where culture really value to each and everyone in this country as being a multicultural country already. In this condition, being RN and responsible person for my first priority is putting my patient to the comfort zone for the further treatment. At the same time, my responsibility will be putting myself and hospital in a safe zone by following hospital policy and procedure. And also, I'll reassure my patient everything will be gonna be okay. So you just need to trust upon the RN and the doctors. At the same time, I will teach her regarding the infection control, which will get contraindicated by the hijab during the procedure. I will explain furthermore how hijab might create risks in her airways by blocking for her during the procedure and might make her further choking. So just be aware, we're gonna do these things. Thank you.
Here's another second last question. You have a 12-year-old Aboriginal girl from a remote community on the ward with Curie appendicitis. The IMO advises that he thinks her appendix has ruptured and that she will need to go to the theatre SAP. Her mother was gone up to the town to do her Centrelink banking and shopping. How do you manage this situation?
Thank you for the question again. In this situation, first process includes is filling up the consent form. To fill up the consent form, firstly, I will communicate with the 2 years girl who came to the hospital for the just to collect the information. Her mom was away from the town, or in this time I'll try to contact her mom by asking with the daughter the number. In this case also, if I couldn't contact her mom, I will ask if she got any relative around so that we can do the further process. And again, if I couldn't able to get through anyone for the treatment or the further procedure, I will prefer to escalate all this problem to my team leader so that she can set up everything before something gonna happens or disaster gonna happens.
Okay, here comes the last, not the least of the question. The border mother of 6-month-old admitted to the ward with pneumonia returns to the ward after an evening off the ward. She appears to be intoxicated as she has an ataxic gait and smell of alcohol. She picks up her son and starts breastfeeding him. When he approaches, she asks for some sandwiches to eat as she has not had any dinner. How do you manage the situation? Thank you.
Thank you for the last question, madam, again. In this scenario, being a responsible person to look after 6-month-old baby, my actions will be advocating baby for his health. Being Aryan, my focus will be child during care provided or hospital stay. After admission of baby, the role of mom will be the only assisting baby with feeding at the time with the milk. Dressing up baby, bathing, giving medication will be in the hand of nurses only during the shift. And the mom have right to go out, but before discharge and after admission, it is hospital and RN responsibility to provide quality of care and putting away Bob from the risk. After seeing Bob mom intoxicated with alcohol being RN, my responsibility will be communicated with mom and make her aware about the situation the baby having and the disease he's having. And also I'll try to teach her not to breastfeed for a while so that the baby not gonna get intoxicated with the alcohol again. And also I will tell her not to put him for the further risks which can create longer hospital stay in the future. Thank you so much. Thank you so much everyone for having me in this interview and giving me opportunity to drop my some of the views. Thank you. Thank you again.